Evening, St. Lucia. Sorry, good morning, St. Lucia. Welcome to our weekly briefing put on by the United Workers' Party. We continue to address the healthcare crisis which befalls this country, which makes you, the people of St. Lucia, very anxious. In fact, a lot of you have now developed more confidence in the home care. Too often, I hear people saying that I rather take my loved one home because I will take better care of them at home rather than the hospital. This is where we have reached in this crisis. You go to the hospital and you can't get a simple thing as a bed. We see elderly people, children even, are there in chairs, wheelchairs, sleeping for days, sleeping in the hallways in cots, terminally ill, and in their weakest of moments, looking for help from our country, cannot receive that help. But yet the government tells us that there is progress. They even had a march for progress. That's the hypocrisy of the St. Lucia Labour Party. You go to the hospital, no medication. You try to do a scan. They tell you thousands of dollars. You have to go to the private facilities because our healthcare facilities are not properly equipped. All of this is endangering you, the people of St. Lucia. This is happening, interestingly, at a time while the country goes through a very serious crime crisis, which is having its own impact on the health facilities of the country. You hear medical professionals tell you that doctors and nurses and other health practitioners are overwhelmed by the alarming rates of crime which continues to afflict our very youth population, the most productive sector, and many others. Just recently we see a 15-year-old perishing, and the health facility could not have done anything for her because her injuries were so severe. Several health centers are now closed. The Ministry of Health announced quite recently. And so the health centers, which are supposed to play a preventative role in taking off some of the strain from our tertiary level institutions in the country, like Owen King EU and St. Jude's, are no longer able to play that role. You can't walk within distance, as some of you are accustomed to get reprieve in your weakest of moments. Every single person in this country deserves health care. But yet we see that when the government ministers are sick, they go overseas. They are able to afford the international health systems of the world. This two St. Lucias that our health service has created must stop. And that's what we are fighting for. We are fighting to stop this. We're not here just advocating every week because we want to assume power or to destroy the country as the government has suggested, but we are here to give your problems voice in this country. We are here to sound the voices for those of you who can't afford to speak because of your jobs, because of different stage, where not one, not two, but several of our health centers are now suffering from poor air quality. It tells you that there's no management of the facilities. It tells you that the government is not focused on managing our health facilities so that they could be sustained and they could be maintained at a decent level so that when you, the people of St. Lucia, require help, that you can get the help that you need. And so now, several communities are without health centers. The other hypocrisy about this is the sudden appearance of CIP monies to help to solve some of the problems in our health sector. And I want to say to the Prime Minister, that this superficial PR announcement of the use of some of our CIP funds to go towards Owen King EU does not begin to solve the quantum of the problem that exists at the Owen King EU hospital. We have seen reports which suggest that the demand for healthcare in St. Lucia is over $350 million. And if we add inflation to that, because those assessments are years old, it would mean that the demand for quality healthcare in St. Lucia is close to $400 million. Now, when you look at what was budgeted in the estimates of revenues and expenditure, it's somewhere around $170 million. That $170 million is way below what is required in our healthcare system to give us not ideal healthcare, but just good healthcare. So we are a long ways off. So the question of financing of our healthcare sector has got to be the most important question. It is the bedrock of solving the issues surrounding our healthcare situation in the country. The United Workers' Party, while we were in, proposed medical insurance. We said that if we're going to beat back this problem of no medication, a lack of facilities, no bed sheets, no Panadol, no toilet paper, no beds, not enough space, is that we had to do several things. We had to, first of all, fix the financial situation as it pertained to healthcare. This government proposed a health and security levy, which we know now is not truthful, because in all of the budgets that they have submitted to the Parliament since the health and security levy did not show a corresponding increase in the amount of finances that they would have spent in the healthcare sector. What we have seen is a decline in some years since they were picking up the health and security tax. And so you must be very careful here. On one hand, the government tells you, but we knew the truth that we found out later, that the government was then using this money to encourage the CDB to give them a loan. In other words, a policy-based loan. Now, what has happened to the idea of financing it? The St. Lucia Labour Party has shelved the whole idea of making sure that you, the people of St. Lucia, receive better medical coverage. To improve the bed count in St. Lucia, this is very, very simple. In fact, the issue at St. Jude's, their own report suggested that they would have finished the hospital and the people would have been moved from the stadium by now if they had continued with the existing plan. But instead, what they want to do is to continue with a plan which, when they would have come to an end, they would have spent about $400 million on the old Labour Party plan, which has been going on for many years. There doesn't seem to be enough done on preventative health care. And we want to submit to you today that preventative health care is the key to this. There has to be more behavioral rather than a clinical approach to the healthcare system. And this is what the United Workers' Party will do, is to spread more awareness about your diet, is to avoid those foods that will give you diabetes and lead to hypertension and heart attacks and lifestyles that would lead to cancer. These are the kinds of solutions that we are bringing to the table so that we can arrest this health crisis that is facing us at this present time. But the very least that this government can do is to better manage the facilities, is to not to make excuses about the crisis, but to lead in this crisis. Because without leadership, we cannot come out of the crisis that we face. And the United Workers' Party will bring leadership when we are elected to serve you, the people of St. Lucia, whenever the Prime Minister decides to call the election. And so We understand the burden of history on our shoulder. We understand that the role we've always had to play in whenever St. Lucia has got a crisis. And that burden of history on our shoulder reveals that we have always had to put our shoulders to the wheel and to come forward and to rescue St. Lucia, whether it is crime, whether it is an economic crisis, whether it's a governance crisis. We have always played that role in history before, and we stand ready to play that role in history once again. I thank you.
Thank you very much, Senator Fede. As we continue our discourse, pleasant good morning, bonjour pour tout Saint-Lucien, parce que semaine ça, c'est semaine créole. Moi, je prendre l'occasion ça pour souhaiter tout Saint-Lucien a bonne fête créole. Moi, ça rôle durant semaine l'année célébration qui prend place en différents communes. Nous savons qui manière bail la Saint-Lucie, so nous ka parler bail ses chauffeurs. Là où kay drive à Sushima, pas boire ek drive parce que nous savons bail pas belle à l'hôpital là. So pas mais qu'on a dans situation pour y vers l'hôpital durant temps ça nous a dit là. Aussi nous avons quantité crime qui a pris place en Saint-Lucie. So point précaution qu'on ka aller, qui manière qu'on aller, pas acheter des agréments avec moun, comporter qu'on bien et en passer en bon saison fête créole. Now I move away from the issues of celebration of Creole Day to the pressing issues that we have before us. And I want to make a couple of very profound statements. There is a high level of disrespect shown to St. Lucia's or St. Lucian's intelligence and tolerance by this Philip J. Pierre administration and the persons they appoint to various offices. And I will repeat, there is a high level of disrespect shown to us as St. Lucians, disrespect to our intelligence and our tolerance, because I believe that St. Lucians have been very tolerant of what this administration led by Philip J. Pierre is doing. You know, I will make a couple of other remarks. As we reflect on this past weekend's activities, we would have recalled the attendance of the Labour Party activity by Dr. Ralph Gonzalez. I always regard and respect leaders, but leaders must first learn to respect themselves if they are going to earn the respect of the people. And so Dr. Gonzalez came to St. Lucia to help celebrate with the Labour Party. I want to ask St. Lucians, couldn't the Labour Party find a black prime minister like the black boy to help them celebrate? Because here we are, and it's the hypocrisy of what happens in this country. So you don't like the political leader of the United Workers' Party, the Honorable Alan Michael Chasney. What is the difference in the complexion of our political leader and that of Dr. Ralph Gonsalves, who you praise as the Prime Minister of St. Vincent for all of these years, and you couldn't find a better man to bring to St. Lucia. So Dr. Gonsalves is good for St. Vincent, but you want St. Lucians to believe that Alan Chasney is not good for St. Lucia. St. Lucians, that is why I tell you our intelligence and our tolerance is being abused by this Labour Party administration. So, if there are so many other people in St. Vincent, and Dr. Ralph is so good for so long, I believe that the Honorable Alan Chasney is better for St. Lucia. But here we go. There are a couple other things I will tell you. My wife taught kindergarten for a number of years. She taught from kindergarten to university level. And what a teacher will always tell you, and other teachers can tell you that, and parents in St. Lucia knows that there is always a contention at home between what teacher says and what parent says. And most parents will tell you, the child will always tell you, but teacher said that. And if teacher said this, then it is right, because it is teacher who said it. Where am I going with this? The same applies to doctors. Not doctors like Dr. Kenny Anthony or Dr. Ernest Hille, but medical practitioners, medical doctors. Because not everybody who carries a PhD or a DR before their name is a medical doctor. And so, when you go to visit the doctor, when they send you for various tests, and you are waiting the results, you are anxious. You have sleepless nights. You get jittery because you're not sure what the diagnosis is going to be until you go to your doctor and your doctor reads you the results. So a doctor's words means a lot in this country when it comes to our well-being and health care. And so when the medical doctors will write a letter to the board of directors of a hospital to say to them, look here, we have a serious issue with health care in this country. But nobody was paying attention. I don't like to just say what I want. I always try to back up what I'm saying with evidence. So I have a copy of the letter from the Medical and Dental Association, and I have a transcript from the report on, I think it was DBS Newsworld, Zane Romulus, from the CEO who chose not to renew his contract at the OKEU hospital. Now, it is important, and that is why I made the point earlier, that our intelligence and our tolerance is being disrespected in this country. And I will show you what the CEO said and what the Medical and Dental Association said. And you, St. Lucia, young people, university graduates, the man on the streets, you will understand what I am saying here. Now it says, according to Dr. Dexter James, personal and professional factors were playing in his decision not to continue as the CEO. Dr. James's contract officially ended on Wednesday. The facts are that I submitted now I'm quoting what he said in the news report. The facts are that I submitted my official resignation to the board of directors on August 2nd, 2024, expressing my intention not to continue with the complex. At no point was there any decision on renewal or discussion on renewal of my contract. End of quote from him. So, his resignation, 2nd of August 2024, I guess gives sufficient time. He said his decision was personal and professional. I understand the personal because I don't need to go into a man's personal business. But I need to understand, and I think St. Lucia needs to understand, the professional factors that would have influenced somebody taking a job to be the CEO of a hospital and then to decide not to renew the contract. But the reason why I question the issue of the professional aspect of it is because of what the rest of the news report says. And I want you to bear out with me because we're talking about saving the lives of St. Lucians. He says, I want to emphasize that my decision to resign was made independently. The outgoing CEO has refuted speculation that his departure from the health facility had anything to do with recent issues at the OKEU hospital. So he is saying that his decision to resign had nothing to do with the issues at the OKEU hospital, but he said there were professional reasons. 2 days before Dr. James submitted his resignation on August 2nd, the St. Lucia Medical and Dental Association sent a letter to the hospital board of directors calling on the board to step up to fix the myriad of problems, worsening issues at the facility, or step out. Now, these are strong words coming from the body of doctors, medical practitioners in this country. And so, I want you to understand what the CEO said, and I will tell you why I am happy that this CEO is gone. Because his words don't match with what is here. And I call into question, sir, the integrity of what you have said. I don't know enough about you to criticize you personally, but I have an issue with what you have said. The issues that have come to the media that appears almost negative goodwill for the facility was quite unfortunate. And here's what he says. Because we had just begun working with the Ministry of Health and the board in getting additional resources to address some of the problems we've had, mainly due to questions of unavailability of drugs and supplies. How long had this man been the CEO of OKEU Hospital? And at the writing of this letter or that news report, when you submitted your resignation on the 2nd of August 2024, you had just begun working with the board to resolve the problems. So what were you doing before, and what were you being paid for? And I believe that the country needs to ask for a refund from this individual. If you are going to write and you are going to give a televised news report that says it is rather unfortunate because you had just begun working with the ministry, how could it be that you just began working with the ministry when you've been the CEO for about 2 years? That baffles me. And it tells me how much disrespect this Labour Party government and the people they employ have for the intelligence of the people of St. Lucia. And that's not all you know, because I want you to understand. So you need to tell us what was happening before, because he says they just started to address the issues of additional resources. Some of the problems were mainly due to the question of unavailability of drugs and supplies. How many years have we been hearing since Labour came into office that there's no Panadol, there are no bed sheets, there's nothing available at the hospital? But all of a sudden, a CEO wakes up one morning, a CEO of a hospital. You know what the chief executive officer is? You are the overall person. You ought to know what is happening from the cleaners up to yourself. And you just realize that the hospital was out of drugs and out of basic supplies, while people have been saying this on the radio for months. It is over a year I called the hospital. My brother was a dialysis patient there. And I said on a number of occasions his dialysis was cut short because there was no water at the hospital when there was no water shortage in St. Lucia at the time. And can you believe the high official at the Ministry of Health told me they were not even aware that there was no water at the hospital when everywhere else had water? I mean, what is going on in this country? Here's what the CEO says. We've expanded our supply chain. We have restored goodwill with a number of creditors. Now, when I heard the word restored, it means that you had lost it. Isn't that so? For you to restore a relationship, the relationship must have been broken. Isn't that so? So at what point did we lose our relationship with creditors went bad? And you'd recall months ago at a meeting, a Sunday live meeting, I pronounced that I knew lawyers were writing letters to the government from suppliers providing medical equipment, Panadols and different things to the hospital to keep it operational. And they had reached a crisis point where the business would go into bankruptcy because they themselves could not pay because the government was not paying them. We have a Minister of Health celebrating 50 years in Viewfort North. I'm coming to this. So you expanded your supply chain. We have restored goodwill with a number of creditors. They've opened back accounts for us. So open back means what? It was closed. At what point were these accounts closed? St. Lucians, this is a statement from the CEO of the hospital. Why was all this going on? While the doctors were writing, The patients were complaining, and the government did nothing about the situation. And this CEO, wherever you came from, you have that level of disrespect to St. Lucians that this is what you are going to write, that we've now reopened accounts, they've given us credit terms, they have given us credit lines, so the platform was set for the future development of the hospital. Future development, a brand new facility y'all went into, everything modern in the hospital. In 2 years, in 3 years of the Labour Party, this hospital has deteriorated to the point where you have to talk about future development of the hospital. Now, Dr. James is confident that his work at the medical complex over the past 2 years has left the hospital on a better footing than where it was when he took over. Now, these are not my words. Mr. CEO, can you refund St. Lucia the money you were paid? Because you've been a big failure. And that's why I feel comfortable. That's what he said. I feel comfortable that the decision not to renew, although it is very personal, would have left the facility in a better state than it was 2 years ago. So that whoever comes on with good leadership and being able to rally as a second senior leadership team would team around a particular set of values and strategic decisions, I think the complex can move forward to greater improvements in care of the public. Now, that's a report from DBS Newsworld. Now, we have 2 letters there that contradict each other. And I want to believe that I will trust my medical doctors and the Medical and Dental Association much more than I can trust what has been said by these people or this CEO. And here's what the Medical and Dental Association said. We write on behalf of the physician body of the O.N. King to express our utter dismay and disgust with the current state of affairs on the island's main hospital and by extension our healthcare system. So Mr. CEO, if you think you left it better, the practicing physicians, the practicing doctors are saying that what you said there is not true. It says the consensus, and I want you to understand that this is not the words of Dr. Merle Clark. She did not write on her behalf as usually happened on the Labour Party. She wrote on behalf of the Medical and Dental Association. And the letter states, the consensus of the physician body is that the board of directors, ostensibly tasked with drafting policy to allow for the efficient running of the hospital, has failed miserably in the said task. Mr. Minister of Health and Mr. Prime Minister, it is evident that the board is one of the biggest problems of the OKEU hospital. Why have you not fired the board? Why have you not asked the board to resign and replace them with more efficient and competent people? You have rather allowed the situation to escalate, where it is now not the board, but it is the doctors who are resigning. It is not the CEO, it is the doctors who have resigned. Can the board give us the health care without the doctors? Can the board members go and attend to those who need medical care? You see, this is the problem in this country. Why hasn't the board been fired? If it has failed so miserably, the focus of a significant proportion of the board membership appears to be solely on micromanagement and creating a toxic work environment as opposed to ensuring conditions are in place to guarantee the best possible care for the patients. You know what it is to have a toxic environment in a hospital? And imagine the toxic environment is created by the board. So it's like the board working against the workers of the hospital. I will touch two other areas on this later. And it says on page 2 and the last paragraph, and the doctors are speaking here, many of us have worked and sacrificed tirelessly at VH and OKEU for close to or more than 20 years. And we can categorically say, never has it been so bad. So, Mr. CEO, you tell me how you left it better when the practicing physicians and healthcare practitioners are stating that it has never been so bad before. So who is lying? Who is misleading? The other part I want to touch. How do you justify the money spent on expensive billboards all over the hospital? New vehicles, but the concurrent lack of drugs, including but not limited to Panadol, ibuprofen, antibiotics, lack of equipment, storage of lab supplies, anesthesia, and the list goes on. What alternate universe are we existing in that priorities are this skewed? Can you imagine the strength of these words from the Medical and Dental Association? You would think that it is aliens who are in charge of the hospital, because the doctors are saying that you have to be living in an alternate universe. You cannot be in the universe where Earth is. To tell me you're spending money on billboards, on vehicles and all of that, and the basic supplies, plaster, gauze, bandages, ibuprofen, Panadol, not available at the hospital, and we have a Minister of Health getting paid in excess of $12,000 every month. And that is what is happening to our people. And here's what the doctors say in closing. The citizens of St. Lucia deserve better. The current conditions are unacceptably dangerous and inevitably will lead to undesirable outcomes. You know what these undesirable outcomes are? The death of people. Sickness is escalating when it could have been treated. Now, Mr. CEO, whoever you are, the CEO, it is evident that either you are a big failure or you are trying to cover up for incompetence of some people. Because I trust more what the Medical and Dental Association said. And it's not just what they said, you know. I have experienced it firsthand. I took my mother to the hospital. And I couldn't get a wheelchair to bring her inside. I had to literally pick her up in my arms and carry her inside and see her die within 10 minutes. So, Mr. CEO, some of us have lived it. Some of us have experienced it. And like many other St. Lucians who are dying at the hospital, not because we don't have good physicians, not because we don't have good nurses, but because the work environment is toxic and the basic supplies they need to care for the people is not available. And so I say today, as the Labour Party celebrated 50 years of representing Vieux-Fort North, it so happens that the Minister of Health is from Vieux-Fort North. And he has succeeded in less than 3 years to take healthcare backward by 50 years in this country. Because 50 years ago, our healthcare system was better than it is under Honorable Moses Jabatis. So while you celebrate 50 years and you are gloating about how long you've been here, Mr. Philip J. Pierre and members of the Labour Party, are you aware that healthcare is in the reverse? Sir John, in his wisdom, established health centers throughout the length and breadth of St. Lucia. So everybody should be able to access a health center within a 1 mile radius of where they lived. And that was available back in the 80s, coming into the 90s. The Labour Party has successfully closed more health centers in St. Lucia than any other government in the history of this country. And so, St. Lucians, enough is enough. Jufali received his 4 diplomatic passports. Where is the diabetic center that St. Lucia was promised? Where is that $7 million that was paid for equipment for St. Jude Hospital that we have not seen the equipment up to a day like today? And not 1 cent of that was paid under the Alan Chasney administration. It was paid under Stevenson King and Dr. Kenny Anthony. So St. Lucia, we need a match for St. Jude. We need a match for OKEU. We need a match for healthcare. And we didn't just highlight the problems. We want you to know that a united workers' party, we have plans and we have solutions. And first and foremost in the solutions is healthcare. Labour promised you universal healthcare, but yet still they are closing all the government institutions that's supposed to give you healthcare. Ask them how healthcare, universal healthcare is supposed to work. And the final thing I will say, when you return the United Workers' Party to office, rest assured, every single St. Lucian will get health coverage of up to 75,000. Every single person in this country. I believe that is enough to be able to say to Philip J. Pierre, we need the election tomorrow so that our health problems can be addressed. There can be medication, there can be all the equipment and supplies that the hospital needs, and that we can encourage the doctors who have resigned to kindly return and provide the health care that we all need. I thank you, and may God bless you.